Marc Baer with Target, and I'm thrilled to be here today to talk with you about consumer engagement. It's obviously been the theme that we've heard already, and in particular, consumer engagement of the healthcare consumer for tomorrow. But before we actually get into some of those remarks, I actually thought I would start with engaging all of you. And so what you will find, hopefully, in front of you is a polling device. And I have a few questions that I'm going to ask each of you, and I'll guide you through the process. So grab that polling device, and let's go to our first question. Do you understand all of the details of your own health insurance benefits? So as you think about that, press 1 for yes or 2 for no, and we'll give you a few seconds to do that. Moving on to our second question. Have you ever had an unpleasant, frustrating, or confusing healthcare experience or moment? Again here, just press 1 for yes or 2 for no. And then finally, as it relates to that confusing or frustrating healthcare moment, can you explain for us what the reason was? Was it because of the health issue itself? Was it the way in which you were treated by either the healthcare provider or their staff, or the health plan or the insurance process associated with it? So here again, we'll just ask you to press, but you have 3 options this time, 1, 2, or 3. Great, so let's take a look at our results and start first with the first question we asked, which, as you'll remember, was about whether or not you understand the details of your own health insurance benefits. Now, as I look around the room, I'm pretty sure we're all healthcare professionals. And yet it's surprising to find that over 2/3 of us, actually over 3/4 of us, don't understand our own health insurance benefits. Now, if that's the case, what hope does a consumer that isn't familiar with healthcare really have of understanding it? Second question was, as you'll remember, whether or not you'd had a frustrating experience in healthcare. A large number of you haven't, but there's a fair number of you that have. And I would venture to guess that if we polled people that didn't have the understanding of the healthcare system that we all have, that number would be a little bit higher. And then finally, what were the reasons that drove that healthcare experience that was frustrating? Moving into the third slide, what you'll find, and this isn't surprising to me at all, is that a good chunk of that was actually related to things pertaining to how you were treated, whether it was how you were treated by the healthcare provider, their staff, or the insurance process. How you were treated really mattered. And that moves us then into my slides as it relates to why Target is here. Because Target knows something about the consumer experience. Target understands the value and the importance of the experience. And in fact, we found at Target that over and over, guest satisfaction is driven by their perception of the experience. The way they experience a particular product or service or situation is just as important to their satisfaction as the product or service itself. Let me say that again. The way in which someone actually experiences the care they receive is just as important as the quality of the care itself. At Target and as a retailer, we can't just satisfy our guests' expectations. We have to exceed them. And so, as a result, we know that our guests don't have to come back to us. We must provide an experience that makes them want to come back. There are certainly lessons here that healthcare can learn from retail and from other industries as well about how to engage with guests, especially with the new healthcare consumers that are starting to come into the system. Because I guarantee you, those consumers are going to have more of a consumer mindset than those of the past. The attitude will be, I may have to come back to someone, but not necessarily to you, especially if they don't like the experience that you provide. So this perception phenomenon isn't just unique to retail. It's something that's also been noted in healthcare, most recently by the Journal of Clinical Oncology. In the journal, they reported a study that was done by the Mount Sinai School of Medicine and Columbia University Medical Center, which showed that 88% of breast cancer patients studied received care that was considered in line with best treatment guidelines. However, and it's a big however, only 55% of them actually felt like they got the best care. So well over a 30% difference in how they actually felt about the care they received relative to whether or not it was in line with best treatment guidelines. As such, the objective measure of quality didn't necessarily translate into satisfaction. Other things were important too. Open communication, ease of service, and other experiential factors were pivotal to the patient's definition of the kind of experience they received. So what that means to us at Target as a provider of health, and yes, we are a very large provider of health. We have over 1,600 pharmacies. By the end of the year, we'll have nearly 70 clinics. We have several hundred optical locations. We have a large stake in the health of our guests, and that means that because that's true, and because we're a retailer focused on guest experience, We have to make sure that we define that experience to understand our guests' subjective expectations. So to do that, and I'm going to echo what Dr. Saunders said, we have to make it easy. The way we look at this is we think about simplicity and we think about connection, because we know that when you connect with people by simplifying something that's complicated, they are going to engage. That's the single biggest incentive driver you can have, is by actually connecting with people. And so in the end, we're all striving for the very same thing. We want to help people strive to become active engagers in making their own lives healthier. And we want to be on that journey with them. We want to be there with them as the consumer of tomorrow engages with us. And I'm very thrilled to be a part of the panel discussion that will talk about that with you more. Thank you.